In the healthcare industry, there are two concerns. The first is legacy systems. And what I mean by that is systems that have been in healthcare providers, they're using them in their computer networks for a very, very long period of time. And as those systems age, they have bugs in them that can be exploited by third parties. They don't have the level of sophistication that modern software may have. And so software that was written 5 years ago that is still being used by a healthcare provider may have security flaws in them that could be easily exploited. The second thing with regard to healthcare providers and information security is cloud computing. And healthcare providers are struggling greatly with this issue of whether or not they can put protected health information in the cloud. Nonetheless, healthcare providers should be reasonably cautious about this, particularly when online providers, cloud providers, are not willing to provide the level of protection necessary to really be responsible for the information they're entrusted with. EHR system or electronic health record systems can be cloud-based and or locally installed. And in many instances, it is a very difficult decision for a healthcare provider to move into the cloud entirely. It means entrusting the operation of one of the most important things, the electronic health record, the information about their patients to a third party. Even something as simple as, will that information be available when someone comes into the ER and they have an emergent condition, need to be treated immediately? Can we get access to that information? So it goes well beyond just keeping the information confidential. It means, is that information available? Is it accurate? Can we rely on it? HIPAA in and of itself does not preclude the use of cloud providers. It does, however, it mandates that businesses, healthcare providers must be cautious when entrusting others with their operations, particularly protected health information, and they have to do so reasonably. And that means assessing the particular risk of this particular vendor and making a reasoned decision.